Good morning, dear chair, dear audience. Let me present my PhD research progress in the following minutes. It is titled Approaches in Improving Quality of Life in Pregnant Postpartum Women. My name is Lőrinc Frivaldszky. I'm a resident at the Bethesda Children's Hospital and a PhD student. My vision is an improved quality of life for women during pregnancy and the postpartum period. And we would like to achieve this by finding solutions that can prevent and treat complications in this time frame. We have two projects ongoing right now. I'm going to present the first one a bit more in detail. It is titled Investigating the Efficacy and Safety of Esketamine Administration to Prevent Postpartum Depression in Women Undergoing Cesarean Section. So, postpartum depression, or PPD, is a prevalent but treatable disorder that affects 14% of women after giving birth. It has a wide range of clinical features. It includes sadness, sleep disturbances, and even suicidal behavior, among others as well. And women who are undergoing cesarean section are especially at risk for this disorder. Currently, no pharmacological prevention method is known in the literature. But we have esketamine that is used in psychiatry to treat depression, and it might have a positive effect on PPD as well. So we aim to assess the safety and efficacy of esketamine administration to prevent PPD. For this, we have a clinical question that does esketamine reduce the risk of postpartum depression in women who are undergoing cesarean section? We use the PICO framework for this. The population is women who are undergoing cesarean section. We will compare esketamine administration perioperatively to placebo or standard of care, and our primary outcome is the PPD rate. Secondary outcomes are adverse effects and different scale scores. And we think that esketamine is superior in reducing postpartum depression risk compared to placebo. Thus, we can contribute to guidelines about the prevention of PPD. During our systematic search, we use the following search key consisting of two domains. The first one is about the intervention and its synonyms. The second one is about the population we want to look at. During our selection process, we ended up with 17 eligible full texts, and I would like to present a few plots from our analysis. This first figure presents the odds ratios for PPD in the first 3 and 7 days after giving birth. And here you can see 3 subgroups that we assessed based on the administration method of esketamine. The first one is a single dose, single infusion of esketamine. Second one is PCIA, or patient-controlled intravenous analgesia, that is given after the operation. And the third subgroup is the combination of the two previous methods. You can see the esketamine groups on the left side and the controls on the right side. And the overall pooled odds ratio is 0.43. That it means that we were able to reduce the PPD risk, the odds of developing PPD by almost 2/3. And it was a significant and clinically relevant decrease as well. The second one is one of our secondary outcomes. This is the Edinburgh postnatal depression scale that is used to assess the severity of PPD. It's a scale between 0 and 30. 0 means no PPD symptoms. 30 means the most severe that you can imagine. And we concluded that EPDS scores can be reduced by 1.32 during the first week by the administration of esketamine, and this was a significant result as well. The third and last plot is about the safety of esketamine. These are different adverse effects that were measured after the administration of this intervention. And you can see the pooled odds ratios after every adverse effect on the plot. Only 2 adverse effects were significantly higher in the intervention group. It was dizziness and hallucinations, but fortunately, the overall absolute rates of these adverse effects were low. So our study has certain strengths and limitations. We used only RCTs with overall low risk of bias studies, and the limitations are the low number of cases, the low number of studies, and the differing definitions for postpartum depression among the certain studies. And we had a low diversity because all studies were conducted in China. So we can conclude that that esketamine can be safely and effectively used to prevent PPD in this population. So we can use it in clinical practice, but there is a huge need for further studies to assess this intervention with longer follow-up periods, diverse populations, and standardized definitions for PPD. And of course, it will be highly interesting to assess women with natural delivery methods as well, not only cesarean section. Our manuscript was submitted, and currently we sent back a revision a few days ago. So we are very optimistic about this one, and we really hope to get accepted soon in the near future. About our second project, it is investigating the efficacy and safety of interventions against nausea and vomiting in pregnancy. This disorder affects most of the women during early pregnancy, almost 80%. In most of the times, it is not severe, but it can result in serious complications if left untreated. For example, malnutrition, depression, intrauterine growth retardation for the baby, and pregnancy termination, and so on. And there is a wide range of interventions that is used to treat nausea and vomiting in pregnancy, but the efficacy and safety data are unsatisfactory, as there is no consensus which is the safest and most effective to use in this population. And our aim is to assess the efficacy and safety of the available interventions against nausea and vomiting in pregnancy. Our question is that which intervention is the safest and more effective against NVP? We would like to compare the available interventions that has efficacy and safety data in the literature. We would like to assess the efficacy by the number of vomiting episodes, the puke score, and the visual analog scale scores as well, and of course the safety outcomes to assess the safety of this intervention. So this way, we think that we will be able to assess which intervention is the safest, and thus to contribute to guidelines about this topic. We use the following search key with 3 domains. The first one is the disease itself. The second one is also regarding the population, and the third one is about the study type of the publications we are interested in. At the end of our systematic search and selection, we ended up over 100 eligible full texts, so it will be a larger scale study than our previous one. And we are currently doing the data extraction, and we hope to proceed with the further steps in the near future as well. So to conclude our research progress, our first study was already submitted and waiting for the second review after a revision. And the second one is planned to submit this spring. So I would like to thank your attention with a quote from the Bible: "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Thank you for your kind attention.
I have a question for the second study. Yeah. You mentioned the treatment for the nausea and vomiting. Across the studies, there was a huge number of studies that will get involved in the meta-analysis, but what were the most common treatments found, and were the adverse events taken into account in these studies?
Thank you for the question. So it was a really long list. So to just summarize it, there are certain pharmacological interventions, for example, steroids, antihistamines, and further drugs. But most of the studies, interestingly, were about the non-pharmacological interventions, including dietary supplements, vitamins, and even acupuncture and acupressure as well. So it is really interesting, and it will be really exciting to see the results, which is the most effective one.
I also would have a question, but to the first project, and regarding the study population. So prior the study, what have you found in the related and included articles? Have they done a risk analysis for the patients who included patients with higher risk for depression, or this study population represents the general population?
Thank you for the question. It represents the general population, but different studies, there's different criteria, but most of them excluded pre-existing psychiatrical conditions and thus high-risk patients for developing PPD.
Thank you very much.
I also would like to ask you a question regarding to your first topic. That first of all, that the esketamine, what is the way of administration? How do you give this drug?
So for this goal in our study, they used it intravenously. It was either a single infusion that was given during the surgery after the umbilical cord was clamped. They started the infusion right after that, or it was given after the operation in the postoperative period with this patient-controlled analgesia method, where they can control the amount of the drug that they get, and some of them use the combination of these two methods. But in psychiatry, they use it mostly intranasally, esketamine.
Okay, thanks, because it's important if the vaginal deliveries, they are going to be also included, because it's an important topic. And my second question is that, is there any correlation with the postpartum psychosis or any more severe psychiatric diseases than the postpartum depression? Is there any studies about that? Are there any studies about that?
It certainly has, but these studies, they didn't get any data regarding other postpartum psychiatrical disorders. They focus solely on PPD, but it will be very interesting to see the connection between certain disorders as well in the future.